Welcome back to What You Don't Know, a CJ special. Now, the legal ins and outs of reality television. And we begin with the red-hot makeover shows, and we're joined by Dr. Randal Haworth from The Swan on Fox, and from ABC's Extreme Makeover, Dr. Harvey Levin. Gentlemen, thanks for joining us. Behind the scenes, what I'm hearing from plastic surgeons is there's some talk about what these patients have to sign. We know they sign consent forms. Do they waive their legal rights?
The patients who come to me in every situation, either normally in my office or patients that are through this program, sign a consent. And the point of the consent is to make certain they fully understand what it is that you intend to do.
And the risk.
And they agree, and the risk.
But if something goes wrong, are they signing their rights away?
Oh, absolutely not. These are patients. We still have the doctor-patient relationship completely intact. So if these patients want to sue me and pursue me for, like, say, medical malpractice, they can do so. That is separate from the show's producers.
There is a buzz, again, in the Beverly Hills plastic surgery community, because I've made some phone calls preparing for this, that there might be some excessiveness in terms of the number of hours that people are under while they undergo these procedures. That I've heard the 12 hours bandied about. Is that true?
I'm not aware of any of these procedures that have taken that long. I can only account specifically for the 4 or 5 procedures that I've done that in patients, and in no instance was the surgery more than 5 or 6 hours, and most of them are 3 or 4 hours.
I talked to a plastic surgeon who told me the story. He said, you know, he had a patient who was a huge movie star, and I'm not allowed to say which one, but it's a huge movie star. And everybody kind of wants to look like this person, and the irony is that person went to this plastic surgeon and said, can you make me look different? And it made me think about it, and it's like everybody kind of wants to obtain the unobtainable. Is that a danger in these shows?
Well, what's very, very important with our patients is to have realistic goals and expectations. And we have to make sure that we don't promise our patients something that is unobtainable.
There must be a lot going on behind the scenes just to make sure that every T is crossed and I is dotted.
Well, we do this every day. We're always anxious whenever you take a perfectly healthy person and take their face apart and put it back together again. We're always anxious. As many years as I've been doing it, it's part of the surgeon's personality.
Are the stakes higher because you're on TV?
No, I think that we're so ingrained to, you know, since residency we've been doing this and been taught to work under pressure, that we bestow the same amount of attention on our regular patients as we would on patients under TV. I don't even know that the cameras are there. I find this more stressful than working and doing what I do all the time, and that's doing surgery. And whether there's a camera there and so on and so forth, that's irrelevant for me.
Our sense of responsibility of the patient is the same, be it someone who's ultimately going to be on television or not. Yes, I guess you can say, well, gee, if we had a problem, it would be embarrassing to have a national exposure. But
and legal exposure.
And legal exposure. But you know what? We have that every day anyhow, and it's something we live with from day to day.
Well, I got to tell you something. I am a self-confessed diehard fan of both your shows, and I will be watching next week. Thanks, both of you, so much for joining us.
Thank you very much.
Pleasure.